Every minute, you take around 12 to 20 breaths without even thinking about it. By the end of the day, your lungs will have processed thousands of liters of air, supplying oxygen to every cell in your body and removing waste gases. Without this constant exchange, the brain, heart, and other organs would stop functioning within minutes. This vital process is carried out by one of the most important organs in the body, the lungs. So how do the lungs actually work? The lungs are two large, spongy organs located inside the chest. Their main job is to bring oxygen into the body and remove carbon dioxide, a waste gas produced by cells during energy production. The process begins when you inhale through your nose or mouth. Air travels down the trachea, also known as the windpipe. The trachea then divides into two branches called the bronchi, with one leading to each lung. Inside the lungs, these bronchi continue dividing into smaller and smaller tubes called bronchioles. At the end of these tiny airways are millions of microscopic air sacs called alveoli. This is where the most important part of breathing takes place. The alveoli are surrounded by tiny blood vessels known as capillaries. When you breathe in, oxygen passes through the thin walls of the alveoli and enters the bloodstream. At the same time, carbon dioxide moves from the blood into the alveoli so it can be removed when you breathe out. The movement of air in and out of the lungs is controlled by a muscle called the diaphragm. When the diaphragm contracts, it moves downward and creates more space inside the chest, causing the lungs to expand and fill with air. When it relaxes, the lungs shrink back to their original size, pushing air out of the body. The lungs work closely with the cardiovascular system. Once oxygen enters the blood, the heart pumps it throughout the body. Cells use this oxygen to produce energy, and the resulting carbon dioxide is carried back to the lungs for removal. The understanding of how the lungs function improved greatly through the work of scientists who studied respiration, circulation, and gas exchange. Their discoveries helped explain how oxygen supports life at the cellular level. When the lungs become damaged or diseased, the body may struggle to get enough oxygen. Conditions such as asthma, pneumonia, chronic obstructive pulmonary disease, COPD, and lung cancer can reduce the lungs' ability to exchange gases effectively. Today, artificial intelligence is helping doctors detect lung diseases earlier and more accurately. AI systems can analyze chest X-rays and CT scans to identify signs of pneumonia, lung cancer, or other abnormalities that might be difficult to spot in the early stages. Some hospitals use AI-powered software to highlight suspicious areas on scans, helping radiologists make faster diagnoses. Wearable devices and smart health monitors can also track breathing patterns and oxygen levels, allowing doctors to monitor patients remotely and detect problems before they become serious. The lungs are the body's gateway to oxygen, supplying every cell with the fuel it needs to survive. Understanding how they work helps us appreciate the importance of clean air, healthy habits, and modern medical technologies that are helping protect respiratory health. But breathing is more than just moving air in and out of the lungs. In our next video, we'll explore oxygen and carbon dioxide exchange explained and discover how these gases keep every cell in your body alive.